Thank you for choosing American Pest CEUs. Hi, I'm Sean Reeves. I'm an Associate Certified Entomologist with American Pest CEUs. I've been in the pest management industry since 1999, and I'll be your instructor for today's course. Today's course was compiled by Jack Launius, who has served in the pest management industry since 1990. Today's course is titled Chapter 5, Part 2, Pesticides, Hazards, and First Aid. After studying this chapter, you should be able to 1. Explain the hazard level classification system for pesticides, including the corresponding signal words. 2. Describe typical symptoms of pesticide exposure in humans. 3. Discuss the appropriate first aid response to oral, ocular, dermal, and inhalation exposures to pesticides. And finally, list other health risks, such as heat stress, that may occur during pesticide application. There's going to be a lot to learn in this chapter, as you can see just by looking at this first slide. But let's start with signal words and skull and crossbone symbol. The Globally Harmonized System, GHS, for classification and labeling of chemicals is an international system for hazard communication. The goal of GHS is to help ensure more consistency in the classification and labeling of all chemicals, thereby improving and simplifying hazard communication. This improved communication system will alert the user to the presence of a hazard and the need to minimize exposure and risk. The result should be safer transportation, handling, and use of chemicals. Under GHS, many substances, including paint, oven cleaner, dish soap, antifreeze, window cleaner, and others, could eventually bear common signal words and pictograms. Signal words and pictograms will identify more types of hazards than the current signal words on pesticide labels. For instance, separate pictograms and/or signal words will provide information about chronic toxicity as well as acute toxicity. For the current status and implementation of GHS, go to the link below. There are 4 distinct signal words found on pesticide labels: danger, poison, danger, warning, and caution. Signal words are based on the acute toxicity of the product. Depending on their acute toxicity, pesticide products are categorized into several hazard classes. Some, very low toxicity products, hazard class IV, are not required to have a signal word. Let's talk about our first signal word, danger-poison. Pesticides classified as highly toxic, hazard class 1, with an acute oral LD50 values from a trace to 50 mg/kg must have the signal words danger and poison in red letters and a skull and crossbone symbol prominently displayed on the package label. The lethal toxicity may be based on oral, dermal, or inhalation exposure, depending on which exposure route presents the greatest risk for that particular product. Peligro, the Spanish word for danger, must also appear on the labels of highly toxic chemicals. So you're probably thinking to yourself, how toxic are these products? As little as a few drops of a danger-poison material taken orally could be fatal to a 150-pound person. Note that the human oral LD50 of paraquat, a herbicide active ingredient, is 3 to 5 mg/kg, whereas the rat oral LD50 is 150 mg/kg. Consult the precautionary statements that follow the signal word and symbol on the label to learn more about the product's hazard to humans. Most fumigants, some insecticides and rodenticides, and a few herbicides are assigned the danger/poison signal word. Our next symbol is going to be danger. Now these are some highly toxic hazard class 1 pesticide products carrying the signal word danger without the word poison or the skull and crossbone symbol because of their potential to cause acute contact injury. Danger indicates the potential for permanent or severe damage to skin, eyes, or lungs. For products with this signal word, it has been determined that these contact effects are more dangerous than the acute systemic toxicity LD50 of the product. Several carry warnings of concern about the product's ability to cause irreversible eye damage at low exposures. Consult the precautionary statements that follow the signal word on the label to learn more about the product's hazard for humans. Some herbicides, insecticides, and antimicrobials carry the danger signal word. Our next signal word is going to be warning. So we're going a little less toxic as we go down the chart. We started at the highest toxicity, and now we're going lower as we go through the signal words. Warning is going to be a pesticide product considered moderately toxic, hazard class 2, must have the signal words warning and aviso for Spanish on its label. If the concern is due to systemic toxicity, the acute oral LD50 values range from 50 to 500 milligrams/kilograms. 1 teaspoonful to 1 ounce, 2 tablespoons, of this material could be fatal to a 150-pound person. The concern could also be due to contact injury with skin, eyes, or respiratory tract. The warning symbol alone does not indicate whether the concern is systemic, contact, or both. Consult the precautionary statements that follow the signal word on the label to learn more about the product's specific contact or systemic hazard for humans. Okay, at this point we've reached our lowest level signal word, which is going to be caution. These are pesticide products classified as slightly toxic, hazard class 3, and are required to have the signal word caution on the pesticide label. Acute toxicity may be systemic or contact in nature. If systemic, the acute oral LD50 values are between 500 and 5,000 milligrams/kilograms. Contact effects are generally irritation of eyes, skin, or respiratory tract. Consult the precautionary statements that follow the signal word on the label to learn more about the product's contact or systemic hazard to humans. I wanted to let everybody know there's a big signal word chart out there that does break down all the signal words and talks about the LD50s, the LC50s, the contact toxicity, things like that. I wanted to do it all at the same time and talk about it, but the chart's way too big, the letters will be too small. So we're going to break down each signal word piece by piece and kind of give you a layout for all of them. Now we're going to start with our first signal word and symbol. We talked a little bit about this earlier. This is going to be danger, dash, poison, or peligro in Spanish. This is going to be denoted by the skull and crossbones symbol. The toxicity level and class is going to be highly toxic, hazard class 1. Now, as you can imagine, these are going to be the most toxic products out there. So when we look at the oral LD50s, it's going to be very low. It's going to be a trace to 50 milligrams/kilograms. So you're not going to need to ingest very much of this at all for it to be toxic to you. Now, we're going to see the same type of thing when it comes to the dermal LD50 of these danger, dash, poison, signal word products. In this case, you're only going to need to absorb a trace to 200 milligrams/kilograms of the product for it to be toxic. So again, there's a very low threshold in the amount of product that you would absorb dermally for it to be toxic to you. Next, let's look at the LC50 for inhalation with danger poison. This is going to be trace to 0.2 milligrams/liters. When thinking about contact injury concern when it comes to danger, dash, poison signal word, this is going to be based on oral, dermal, or inhalation toxicity.
But you have to keep
finally,
in mind,
with our danger, dash, poison signal word, our toxicity concern is a very low dose could kill a person, a few drops to 1 teaspoon. So obviously, as we can see, and we're going to close out the danger, dash, poison signal word, very low dosages of this can be very toxic to humans. Our second signal word is going to be danger, slash, peligro in Spanish. Now, the toxicity level and class of the signal word danger is going to be highly toxic, hazard class 1. Our contact injury concern with the signal word danger is corrosive, permanent or severe skin, I, or respiratory damage. And finally, with the signal word danger, the toxicity concern is based on the corrosive or irritant properties of the product. Our next signal word is going to be warning, or aviso in Spanish. Looking at the signal word warning, the toxicity level and class, this product would be moderately toxic, hazard class 2. Looking at the oral LD50 for the signal word warning, it would be 50 to 500 milligrams/kilograms. Looking at the dermal LD50 for products with the signal word warning, this would be 200 to 2000 milligrams/kilograms. Looking at the LC50 inhalation for the signal word warning, this would be 0.2 to 2 milligrams/liters. Continuing with the signal word warning, contact injury concern includes moderate skin, eye, or respiratory damage. Closing out our signal word warning, we have our toxicity concern. This would be small to medium dose, could cause death, illness, or skin, eye, or respiratory damage, 1 teaspoon to 1 ounce. Our next signal word is going to be the word caution. When we look at the signal word caution, the toxicity level and class is going to be slightly toxic, hazard class 3. Continuing with the signal word caution, the oral LD50 is going to be 500 to 5000 milligrams/kilograms. Now with the signal word caution, the dermal LD50 is 2000 to 20,000 milligrams/kilograms. Now with the signal word caution, the dermal LD50 is 2000 to 20,000 milligrams/kilograms. When we look at contact injury with the signal word caution, this can cause mild skin, eye, or respiratory irritation. And finally, for the signal word caution, we have a toxicity concern that medium to large dose could cause death, illness, or skin, eye, or respiratory damage, 1 ounce to 1 pint or 1 pound. Our final signal word is going to be caution or no signal word at all. Products that say caution or no signal word are going to have a toxicity level and class, hazard class 4. Now products with the word caution or no signal word at all are going to have an oral LD50 of greater than 5,000 milligrams/kilograms. Products with the signal word caution or no signal word at all are going to have a dermal LD50 of greater than 20,000 milligrams/kilograms. Products with the word caution or no signal word have an LC50 inhalation of greater than 20 milligrams/liters. Again, with caution or no signal word, contact injury concern is going to be slight concern for skin, eye, or respiratory injury. And finally, with our signal word, caution or no signal word, the toxicity concern is slight to none over 1 pint or 1 pound. Let's talk about chronic toxicity. The chronic toxicity of a pesticide is determined by subjecting test animals to long-term exposure to an active ingredient. The length of exposure is typically 2 years, which represents a lifetime for these test animals. The harmful effects that occur for small repeated doses over time are termed chronic effects. Those of you that are going to be taking core pesticide exams really need to remember this. The harmful effects that occur from small, repeated doses over time are termed chronic effects. So these are not acute effects, just a one-time instance. These are small, repeated doses over that period of time. Those are going to be called chronic effects. This is a very common question on core exams. The following is an example of chronic toxicity. In addition to acute toxicity of alcohol, chronic effects may also occur from alcohol exposure over long periods. Cirrhosis and other liver diseases, miscarriages, cardiovascular disease, neurological effects, and various cancers have been shown to be associated with long-term use of alcohol. As with acute effects, the illnesses and symptoms expressed in different people depend on the dose, the frequency of exposure, body chemistry, weight, diet and exercise, and other factors. The general range of suspected chronic effects from pesticide exposure includes genetic changes, non-cancerous or cancerous tumors, reproductive effects, infertility, fetal toxicity, miscarriages, birth defects, blood disorders, nerve disorders, and hormonal or endocrine mediated diseases. Each pesticide has its own characteristic pattern of diseases and diverse effects that it might cause. However, no single pesticide is likely to be able to cause the entire range of harmful effects listed here. Remember that the tests used to characterize each pesticide's potential for harm are conducted at different doses. This helps regulators determine levels and conditions under which each pesticide could be safely used. Minimizing the likelihood of chronic effects is one of the important reasons to follow all label directions and be cautious in handling and applying pesticides. If a product causes chronic effects in laboratory animals, the manufacturer is required to include chronic toxicity warning statements on the product label. This information is also listed on the SDS. The chronic toxicity of a pesticide is more difficult to determine through laboratory analysis than the acute toxicity and cannot be expressed by a single measure. Thus, there is no chronic toxicity measure equivalent to the acute toxicity LD50. Another important term you need to know about when it comes to pesticide use is delayed effects. Delayed effects are illnesses or injuries that do not appear immediately within 24 hours after exposure to a pesticide. They may be delayed for weeks, months, or even years. Whether you experience delayed effects depends on the pesticide, the extent and route of exposure or exposures, and how often you were exposed. Under precautionary statements, the label states any delayed effects that the pesticide might cause and how to avoid exposures leading to them. Delayed effects may be caused by either an acute or a chronic exposure to a pesticide. You're going to want to remember this term, delayed effects. Again, these are illnesses or injuries that do not appear immediately within 24 hours after that exposure to a pesticide. So these are going to be effects that appear much later. Typically, they may even be delayed for weeks, months, or even years. Remember that because on a lot of core pesticide exams, you're going to see the term delayed effects. Factors affecting response. Like all living organisms, humans have built-in mechanisms to reduce the risk of toxic substances, including pesticides, and to eliminate them from the body. The liver is the primary organ that transforms toxic substances to non-toxic or less toxic forms. The chemical breakdown process performed by the liver also helps make most of these substances more water-soluble. They can then be eliminated from the body in urine. The kidneys are the most important organs in filtering water-soluble pesticides and other unwanted chemicals out of the blood and into the urine. Unwanted substances that cannot be made water-soluble eventually are stored in our bodies, primarily in fatty deposits throughout the body and in breast milk. Most of the pesticides in use today are more water-soluble than those of the past before 1970. Most are eliminated relatively quickly, hours to days instead of months to years in urine. I can tell you an interesting story about the water solubility of pesticides. Back when I first got in the industry, maybe in the year 2000, I had been in the industry for about a year. I went to a doctor because I had a sty in my eye. I didn't even know what a sty was at the time. I was really young. But one of the first things he said was, "Well, what do you do for a living?" I said, "Oh, I work for an extermination company." We called them exterminators back in the day. And he's like, "Oh, okay, so the products you would use would be water soluble, so that wouldn't be an issue." And I go, "Oh, okay, got it." He said, "Yeah, water soluble products really shouldn't cause a lot of problems in the body." So What I'm saying to you is, because we just talked about it, the fact that these products are eliminated from our body in the urine and filtered through the kidneys, they typically don't build up in the body. Like, they're not going to build up typically in the fatty deposits throughout your body and in breast milk like you see on some of the bottom lines here. But the reality of it is, before 1970, a lot of these products were around that did build up in the body. You'll hear about things like DDT and all the effects of these products. So I just wanted to let you know, with the water solubility of most of these products nowadays, you should be okay as long as you applicate with them regularly. Am I telling you they're safe and they're going to have the same effect on every person and you could never get sick? Absolutely not. I'm just telling you, because they are water soluble, the chances of you getting sick are a lot less than they were prior to 1970. Some pesticides can cause changes called mutations to our DNA. DNA is the carrier of genetic information in our bodies. This information is stored as codes for all the chemicals our bodies make to help them function properly. Some DNA mutations do not cause any effects. Others cause serious malfunctions and may lead to various types of illnesses or other problems, such as birth defects. Although our bodies constantly monitor and repair DNA mutations, over time our ability to repair the DNA decreases. That sounds pretty scary in and of itself. I just want to go back to the fact that most of the products out there are not going to cause anything like this, but it is important in our study of core pesticides to understand there has been products and there still can be products that do damage like this. Once again, always read the label, always applicate safety, always wear your PPE, and the chances of any of these things happening can be very low. Our bodies continually manufacture the enzymes we need to help detoxify pesticides and other toxic substances. However, continual or very frequent exposures may overwhelm the body's capacity for chemical breakdown and elimination. Keeping your exposure low and having periods of non-exposure between applications of the same class of pesticide can reduce the chance that your body will be overwhelmed. I just want to make a point here. Obviously, if we're using the same pesticides over and over again, and we are absorbing some of them, they can definitely have negative impacts on our body. Now, obviously, these continual or frequent exposures we talk about here could overwhelm the body's capacity for chemical breakdown and elimination. It's just the reality of, if you're getting too much of something over and over again, eventually your body's not going to be able to break it down and eliminate it as well. We always want to keep our exposure low, as we talked about here, through things like PPE, making sure we're mixing the products right, and then having periods of non-exposure between applications of those same class of pesticides. This can really help your body from being overwhelmed. I don't feel like most of our products nowadays are a major concern with this, but you have to keep in mind, some of you are working with products like Roundup and things like that. Just be careful if you're using the same ones over and over again. First and foremost, protect yourself from being exposed, but make sure you're getting checked up on, and make sure that you're not always using these same products. And even rotating the products or having periods of non-exposure would be a really good thing, as we detailed here. Let's look at symptom recognition. Symptoms can be correlated with certain groups of pesticides. For example, borates, insecticides tend to irritate the skin, nose, and respiratory system. Some fungicides are irritants to the skin, eyes, and mucous membranes of the respiratory system. A non-coagulant type rodenticides affect the blood's ability to clot and may cause bloody noses and bleeding gums. Organophosphate and carbamate insecticides are cholinesterase inhibitors. So we're going to talk more about this as we go, but this symptom recognition can be valuable for you. We talked a little bit about it here, but when you're dealing with a class of insecticides or rodenticides, whatever the case may be, you're going to see they all tend to affect the same parts of the body. Like we talked about here with borates, they're going to tend to irritate the skin, nose, and respiratory system. But then again, when you're dealing with something like a non-coagulant type rodenticide, these actually only affect the blood's ability to clot and may even cause bloody noses and bleeding gums. These things are interesting. We're going to talk more about these as we go, but I want you to understand these classes of insecticides are basically formulated to work a certain way, and because of that, they're going to have different effects on humans. Sometimes, like the non-coagulant type rodenticides we talk about here, that affecting the ability of the blood to clot works the same way on rodents as it does humans. So if you think of it like this, you can get bloody noses and bleeding gums. Well, the problem is that your blood won't clot correctly. It does the same thing to rodents, except for their system's formulated a little different, where they ingest enough of that product that it basically just causes them to bleed out. But keep in mind, you need to understand each class of insecticide and the effects it can have, not just on the insects, but also humans and the environment. They may cause certain systemic symptoms that could lead to respiratory failure and death. Symptoms associated with synthetic pyrethroid insecticides include nausea, dizziness, weakness, nervousness, and eye and skin irritation. Chlorophenoxy herbicides such as 2,4-D and some related products, dicamba, MCPA, and MCPP, are irritating to the skin and mucous membranes. They may also cause vomiting, headaches, diarrhea, and confusion. There's a lot we just said here. Keep in mind, these products can cause certain systemic symptoms that could lead to respiratory failure and death. So respiratory failure makes sense that products could cause that, because obviously there's always a concern of breathing them in, depending on the type of formulation. But the fact that they can lead all the way up to death just re-emphasizes the fact that you have to really know and understand what you're dealing with and make sure you're careful when using these products. When we talk about synthetic pyrethroids, these are most of your insecticides nowadays. So the symptoms of those are going to include those things as we discussed here, like nausea, dizziness, weakness, nervousness, and eye and skin irritation. Typically, those products are not going to go all the way up to leading to death or anything crazy like that. We just have to understand the formulation itself and what the concerns may be. I've also seen these chlorophenoxy herbicides like the 2,4-Ds and some of those related dicambas, MCPAs, and MCPPs. They definitely can be irritating to the skin. I've seen this many times. I've not had a reaction myself, but I know a lot of technicians that have. I've got friends that have. This can be a big deal, and then also its effect on those mucous membranes. So if you're going to be using these products, just make sure you're monitoring yourself, you're self-aware of any effects you may be having, and you can always look at, was I wearing the correct PPE? Am I using the product correctly at the right formulations? Is there an alternative product I can use that doesn't affect me? These are all things we need to think about as we're doing our applications, because you're going to be the one out there in the field, you're making the decision, and somebody just setting you up with a truck and saying go and spray these products is not necessarily all there is to this job. You have to monitor and be self-aware of all these different things we just described here. Now we're going to talk about something that has traditionally been a big issue in the industry. I would say not as much now, but it's definitely something you still need to be aware of. This is going to be cholinesterase inhibition. Cholinesterase is an enzyme necessary for proper nerve impulse transmission and nervous system function. If the amount of this enzyme is reduced below a critical level, nerve impulses throughout the body can no longer be controlled. This may cause serious health problems, affecting the ability of certain muscles, including the heart and breathing muscles, to function properly. Without medical attention, death may result. It seems like the more we talk about this chapter of the core manual, the more we hear some scary things. I can tell you the reality is when we talk about these things can affect the heart, breathing, and even end in death, it is something you need to be aware of, but I would also say that the chances of you going out there and becoming sick and dying are not extremely high. I feel like we're scaring people off from even wanting to work in the industry when we say these things. We're just making you aware that these issues can be a problem. You got to do your research and you got to stay on top of it. But we do need to let you know these things are happening, because if we don't give you that knowledge and there is a problem, it's our fault for not training you correctly. Alright guys, I think we're ready for another exam prep moment. Commonly on core pesticide exams, you're going to hear the term cholinesterase, and you need to understand that it's an enzyme necessary for proper nerve impulse transmission and nervous system function. I also want to talk about this as well that we just discussed, but you really need to remember this. Cholinesterase cannot go below a critical level, or uncontrollable nerve impulses can result in the body. You need to keep in mind, you have to keep that critical level of cholinesterase in the body, or you can start having those uncontrollable nerve impulses. Now you may be thinking to yourself, based on what we've been talking about, how serious is this? Low cholinesterase levels can cause serious health problems, affecting the ability of certain muscles, including the heart and breathing muscles, to function properly. And as we talked about before, this could even lead to death. Just remember, when it comes to these low cholinesterase problems, they can cause serious health problems, again affecting the muscles, heart, and breathing. We all understand this would be a big impact to our health, so just make sure you remember and understand this for the future. You're going to want to know two classes of insecticides, organophosphates and carbamates, act as cholinesterase inhibitors. That is, they reduce the amount of cholinesterase available for the body's use. Cholinesterase inhibition can cause acute or delayed effects. Large exposures to organophosphate and carbamate insecticides can cause immediate illness. Although smaller exposures may not cause outward symptoms, small, repeated exposures over several days or weeks may continually reduce the body's cholinesterase level. This may ultimately trigger mild, moderate, or severe symptoms of overexposure. In the case of cholinesterase inhibition, it is not always obvious whether a worker is showing symptoms from an acute exposure or experiencing delayed effects from repeated exposures. For example, an applicator who is exposed to a single, large amount of an organophosphate may suffer acute effects. However, if over time the applicator is exposed to several small amounts, cholinesterase levels are slightly reduced at each exposure. Eventually, a small additional exposure may cause illness. In this case, the illness sets in soon after an exposure, but only following previous repeated exposures. I think we need to summarize this slide a little bit. It's not always going to be obvious whether a worker is showing those symptoms from an acute exposure or experiencing the delayed effects from repeated exposure. So just keep in mind, any of these symptoms you're seeing or any of these symptoms you're feeling, you need to be aware of, because it can be acute or it can be chronic, depending on how this is working in your system, in your body system, or the person that you're observing. As we said here, someone who is exposed to a single large amount of an organophosphate may suffer acute effects. So if you absorb a large amount of an organophosphate, you may get these acute effects. So this would not be these smaller doses over a delayed period of time. This would actually be an acute effect where you absorbed a lot of the product. Probably in this case, somehow you would have absorbed concentrate, maybe while mixing or loading, you weren't wearing the proper PPE, whatever the case may be, but you could have absorbed a lot of the product at that time and have these acute effects. And once again, just breaking this down a little bit more, when we talk about that repeated exposure to small amounts, again, instead of having that acute effect where it's all at once, this repeated exposure of small amounts that build up in your body can also have the same effect as taking in a lot of the product all at once. And either way, you may experience illness. So the bottom line here is we're just trying to make sure if you're around these types of products, you need to be tested. You need to make sure If you're feeling any of these symptoms, and even people that work for you or around you, you need to keep your eye on them, and you need to make sure that you're observing them to see if they're experiencing any of these symptoms as well. Each person has a certain baseline level of cholinesterase enzyme that is considered normal for him or her. The blood cholinesterase test measures the effect of exposure to organophosphate and carbamate insecticides. A baseline must be established for each person before he or she begins working with cholinesterase inhibitors or during the off-season. Always conduct baseline testing during the time of year when insecticides are not being used, or at least 30 days from the most recent exposure. Establishing an accurate baseline value often requires that 2 tests be performed at least 72 hours, but not more than 14 days apart. Especially when it comes to exam prep, there's some things you want to remember from this slide. Obviously, the blood cholinesterase test measures the effect of exposure to organophosphate and carbamate insecticides. So you have to remember, when it comes to cholinesterase inhibition, you know that it's going to be a blood test. It's not going to be a urine test. I see a lot of times on the exams, they'll try to throw you off. Is it a urine test or a blood test? It's definitely going to be a blood test. When do you establish that baseline? This must be established for each person before he or she begins working with cholinesterase inhibitors or during the off-season. Another way of putting it is, you're always going to want to conduct a baseline test during the time of year when insecticides are not being used, or at least 30 days from the most recent exposure. So just keep that in mind when they ask about the baseline test. When do you conduct these? And we always know, ideally it's going to be in the off season, but at least 30 days from the most recent exposure. So 30 days from the last time somebody made an application with these organophosphate or carbamate insecticides. Also keep in mind, you may see questions or you may hear this. Establishing an accurate baseline value often requires that 2 tests be performed. So this is going to be 2 tests. When you see that question, these tests are going to need to be at least 72 hours apart. So like 3 days, 72 hours apart, but not more than 14 days. So just remember some of these numbers and timelines, because this is very important when it comes to these core pesticide exams. They love to put in a lot of questions about cholinesterase inhibition. If you regularly use organophosphate or carbamate insecticides, cholinesterase tests should be taken periodically and results compared with your baseline level. Also, anytime you feel ill or have mild or moderate poisoning symptoms, your medical professional should conduct a blood test to evaluate your cholinesterase level and compare it with the baseline level. The purpose of a routine or emergency cholinesterase monitoring is to enable a medical professional to recognize the occurrence of excessive exposure to organophosphate and carbamate insecticides. A significant reduction in your body's cholinesterase level indicates poisoning. A medical professional normally suggests that the affected pesticide handler avoid further exposure until his or her cholinesterase level returns to normal. A drop in cholinesterase may require you to have no exposure to these chemicals for a certain period, usually 3 to 5 weeks, to allow your body time to build new cholinesterase. Medical professionals can help to establish the frequency of this testing program, which will depend on how often you use cholinesterase inhibiting pesticides. Occupational and environmental medicine specialists are most familiar with this type of testing program. Also, because different laboratories may use slightly different methods, the same laboratory should be used to collect and test all samples from one individual. So let's talk about some of the common symptoms associated with mild organophosphate and carbamate insecticide poisoning. First, we would have fatigue, headache, dizziness, blurred vision, excessive salivation, nausea and vomiting, stomach cramps, and diarrhea. Of course, we just looked at some of the mild symptoms associated with organophosphate and carbamate insecticide poisoning. Now we're going to look at some of the moderate symptoms. These would include inability to walk, weakness, chest discomfort, constriction of pupils, mild symptoms, and more severe symptoms. And finally, let's look at common symptoms associated with severe organophosphate and carbamate insecticide poisoning. These would include unconsciousness, severe constriction of pupils, muscle twitching, running nose and drooling, breathing difficulty, coma, and death. So as you can see, when we talk about organophosphate and carbamate insecticide poisonings, they can be mild, moderate, or severe. And we can see at this point, once we get to the severe stage, they get really bad and can lead all the way up to coma and death. Just keep in mind, if you're applicating correctly and wearing the correct PPE, as I always say, you shouldn't get to this point. But I also want you to understand that these things can be real and you do have to protect yourself. First aid for pesticide poisoning. Get medical advice immediately if you or any of your fellow workers have unusual or unexplained symptoms that develop within 24 hours of a pesticide exposure. Be alert for the early symptoms of pesticide poisoning and contact or local effects in yourself and others. Do not wait until you or someone else gets dangerously ill before calling a physician or going to a hospital. It is better to be too cautious than to act too late. A little more on first aid for pesticide poisoning. To help the medical professional treat you appropriately and quickly, take the pesticide label with you. Bring either a duplicate copy or the one attached to the container, or at a minimum, the EPA registration number of the product. To avoid contamination and exposure, do not carry pesticides in the passenger space of the vehicle. The label is important because the medical professional needs to know the pesticide ingredients to determine the proper course of treatment. It is a good idea to print off extra copies of the label from the internet. Place one copy in your service vehicle and one in your office in case of a medical emergency. Some states require that labels and SDS be in your vehicle for each product carried on the vehicle. Keep in mind that even symptoms commonly associated with certain pesticides are not always the result of pesticide exposure. Common illnesses, e.g. the flu, heat exhaustion or heat stroke, pneumonia, asthma, respiratory or intestinal infections, and even a hangover, can cause symptoms similar to those of many frequently used pesticides. Contact with certain plants such as poison oak or poison ivy may also produce skin effects like those resulting from pesticide exposure. However, it is best to take every precaution. When symptoms appear after contact with pesticides, always seek medical attention immediately. Immediate action can indeed be a life or death matter in a pesticide poisoning. The product label is the primary source of information. Follow the label's specific first aid instructions carefully. Beyond the label, call the American Association of Poison Control Centers, AAPCC, or a physician for additional advice. The AAPCC's Poison Helpline, 800-222-1222, is available 24 hours each day. First aid is only the first response and is not a substitute for professional medical help. It is very important to get the victim to a hospital or contact 911 for emergency response without delay. Let's look at general first aid. First aid is the initial effort to assist a victim while medical help is on the way. If you're alone with the victim, make sure he or she is breathing and is no longer being exposed to the pesticide before you call for help. Protect yourself from pesticide exposure before and while giving assistance. Make sure you wear the appropriate PPE, including a respirator, if indicated, before assisting someone in an enclosed area. When we talk about general first aid, there's some things I want you to remember for real life issues as well as for exam prep. Remember, this is the initial effort to assist the victim while help is on the way. If you're alone with that victim, make sure they're breathing. Next, you're going to want to remove them from the area of exposure. Before you even think about removing them, make sure you wear the appropriate PPE to protect yourself. This is going to include a respirator, especially if you're within an enclosed area. Also, the final thing you would do is administer artificial respiration if the victim is not breathing and is not vomiting. The following are a few key points to remember when administering first aid during a pesticide emergency. If oral or dermal exposure has occurred, the first objective is to usually rinse the exposed area with water to dilute the pesticide and prevent absorption. Always have a source of clean water available. In an extreme emergency, use water from a farm pond, irrigation system, or watering trough to rinse exposed areas and dilute the pesticide. The following are also a few key points to remember when administering first aid during a pesticide emergency. Never try to give anything by mouth to an unconscious person. Do not induce vomiting unless the label tells you to. If inhalation exposure has occurred, get the victim to fresh air immediately. Become familiar with the proper techniques of artificial respiration. It may be necessary if a person's breathing has stopped or becomes impaired. If first responders are likely to be directly exposed to a pesticide, be sure they wear appropriate PPE. In addition to the AAPCC, you can call the National Pesticide Information Center, NPIC. NPIC provides a variety of information about pesticides to anyone in the United States by phone, 800-858-7378, or online, search for National Pesticide Information Center. Post all emergency numbers near telephones and in service vehicles used by pesticide handlers. Pets, horses, and other livestock may also be poisoned by exposure to pesticides. For emergency information on treating pets or livestock harmed by pesticide contamination or poisoning, call the Animal Poison Control Center 888-426-4435. Pesticide on the skin. Proper hygiene helps protect the skin from pesticide exposure. Keep an adequate water supply with you whenever skin exposure is possible. Other key points. Remove all contaminated clothing immediately. Wash the affected area, including the hair, with water and soap. Rinse well. Showering is better than bathing to avoid prolonged contact with pesticide residues. Avoid harsh scrubbing, which could damage the skin and enhance pesticide absorption. Gently dry the affected area and wrap it in loose cloth or a blanket if necessary. If the skin has chemical burns, cover the area loosely with a clean, soft cloth. Do not use ointments, greases, powders, and other medications unless instructed to do so by a medical authority. Wash and store contaminated clothing separately from the family laundry. If clothing is contaminated with a pesticide concentrate, or if there is a concern about getting contaminated clothing clean, it is often best to dispose of it. Place the clothing in a plastic bag, seal the bag, write the name of the pesticide on it. Take it to a household hazardous waste collection. Make sure you understand this simple point. You always need to wash and store contaminated clothing separately from the family laundry. This is to protect you from pesticide exposure as well as your family. This is a very common question on core pesticide exams, and nobody should ever get this one wrong. Absorb material, fast action is required. Here's some other key points of pesticide in the eyes. Hold the eyelid open and immediately begin gently washing the eye with drips of clean water. Do not use chemicals or drugs in wash water unless instructed to do so by a medical professional or a poison control center. Drip the water across, not directly, into the eye, or use an eye wash dispenser. Continuously rinse the eye for 15 minutes. If only one eye is affected, be careful not to contaminate the other eye. Flush under the eyelid with water to remove debris. Cover the eye with a clean piece of cloth and seek medical attention immediately. Inhaled pesticide. The basic first aid procedure for someone who has inhaled a pesticide is to get him or her to fresh air. Here's some other key points. Immediately carry the victim to fresh air. Do not allow him or her to walk. Do not attempt to rescue someone who is in an enclosed contaminated area unless you are wearing the appropriate PPE. If other people are in the area, warn them of the danger. Have the victim lie down and loosen his or her clothing. As we talk about inhaled pesticide, the basic first aid procedure for someone who has inhaled a pesticide is to get him or her to fresh air. Here's some other key points. Keep the victim warm and quiet. Do not allow him or her to become chilled or overheated. If the victim is convulsing, protect his or her head, turn the head to the side, and watch that breathing continues. Do not attempt to insert anything into the person's mouth during a seizure. Keep the person's chin up to ensure that air passages are open for breathing. If breathing stops or is irregular, give artificial respiration. What about when pesticide is in the mouth or swallowed? If pesticide is in someone's mouth but has not been swallowed, rinse the mouth out with plenty of water. Then give the victim large amounts, up to 1 quart of milk or water to drink. If the pesticide is swallowed, one of the most critical first aid decisions is whether to induce vomiting. Induce vomiting only if the label instructs you to do so. Several pesticides cause more harm when vomited than if they remain in the stomach. To provide first aid for a swallowed pesticide, you must know the appropriate treatment. The decision to induce vomiting must be made quickly and accurately. The victim's life may depend on it. Never induce vomiting if the victim is unconscious or having convulsions, has swallowed a corrosive poison such as a strong alkali or acid. The material burns the throat and mouth as severely coming up as it did going down. Also, it can be aspirated into the lungs and cause more damage. If they've swallowed an emulsifiable concentrate or oil solution product, which is dissolved in petroleum solvents, emulsifiable concentrates and oil solutions may be fatal if aspirated into the lungs during vomiting. A couple important things here for you to know for field knowledge in case you run across this, and of course for core exam prep because these are common questions on there. Remember, you never induce vomiting if the victim is unconscious or having convulsions. That makes sense anyways. Obviously, we're not going to induce vomiting if somebody's unconscious. I mean, obviously, they could literally drown in their own vomit, or if they're having convulsions. Now, if this person has swallowed a corrosive poison that's like a strong alkali or acid, of course, that's already burnt going down. We don't want it to come back up through the throat and mouth because it can burn them again and it can do even more damage. So make sure we definitely don't induce vomiting in a situation like that. Also, and here's another one I see on core exams a lot, don't induce vomiting if the victim has swallowed an emulsifiable concentrate or oil solution product that is dissolved in petroleum solvents. I just took an exam pretty recently and that was one of the questions on there. So keep in mind, I mean, obviously I'm saying these are exam questions, but the reason why they're on there is because in reality you need to know these things. When you're in a situation in a field and somebody gets sick and you have to induce vomiting because some of the pesticides has affected them, you definitely want to follow these guidelines because the last thing you want to do is to do more damage to the victim. Let's talk about how to induce vomiting if appropriate. Induce vomiting only as a first aid measure until you can get the victim to a hospital. Do not waste a lot of time trying to induce vomiting. Follow these steps. Make sure the victim is kneeling forward or lying on his or her side to prevent vomit from entering the lungs and causing additional damage. Give the victim at least 2 glasses of water to dilute the product. Do not use carbonated beverages. Put your finger or the blunt end of a spoon at the back of the throat. Do not use anything sharp or pointed. Do not give the victim salt water. Collect some of the vomitus for the doctor who may need it for chemical analysis. Activated charcoal is another first aid treatment that can be administered when a pesticide has been swallowed. It acts as a magnet to absorb many chemicals. Pharmaceutical grade activated charcoal is available from most drugstores. Activated charcoal prepared for cleaning up pesticide spills may be substituted in an emergency. Seek the advice of a medical professional or poison control center before administering activated charcoal. Take the victim to a physician or hospital. Only general first aid practices have been discussed here. Contact a poison control center for more help in administering first aid. If necessary, get the victim to a medical professional or hospital. Take the pesticide label with you. Let's talk about antidotes. Antidotes are available for only a few classes of pesticides, anticoagulant type rodenticides, and organophosphate or carbamate insecticides. Because antidotes can be extremely dangerous if misused, they should be prescribed and administered only by a qualified medical professional. Antidotes should never be used to prevent poisoning. Another thing we need to think about is the symptoms of heat stress. Mild forms of heat stress make people feel ill and impair their ability to do a good job. You may feel weak or get tired sooner than usual. You may also be less alert and less able to use good judgment. Severe heat stress, also known as heat stroke, is life-threatening. The normal human body temperature ranges from about 97 to 99 degrees Fahrenheit, with an average of 98.6. With heat stroke, body temperature may exceed 105 degrees Fahrenheit. Staggering, loss of consciousness, or convulsions may result. Lack of sweating is a common symptom of heat stroke. Brain damage, or even death may occur if the heat stroke victim is not cooled down very quickly. Now, it's going to be important to know that more than 10% of severe heat stress victims die, including young, healthy adults. Sometimes victims remain highly sensitive to heat for months and cannot return to the same type of work. Heat stress symptoms include fatigue, exhaustion or muscle weakness, dizziness and fainting, clammy or hot, dry skin, altered behavior, confusion, slurred speech, quarrelsome or irrational conduct, headache, nausea, and chills, severe thirst and dry mouth, heavy sweating. Eventually, this can progress to a complete lack of sweating as the body loses the ability to control its temperature. So what can you do if you think you might be experiencing heat stress? You're going to need to act immediately to cool down if you suspect that you may be suffering from even mild heat stress. Drink plenty of water and take breaks in the shade throughout the workday. In hot conditions, watch for symptoms of heat stress in other workers as well. Some adverse effects may occur within 24 hours after a single, usually large, exposure, acute effects. Others may occur many years after exposure, delayed effects, typically from small exposures over a long period, chronic effects. Pesticide handlers can minimize exposure and reduce risk by following label directions, using the proper application and handling procedures, and wearing appropriate personal protective equipment. The toxicity of a pesticide product is measured in test animals by the LD50 and LC50 values. These values determine the signal word that occurs on the pesticide label. Signal words include danger poison, danger warning, and caution, help the user recognize how acutely toxic the pesticide is and what precautions to take. Remember, however, that the signal word only provides information about the acute toxicity of the product. Chronic and delayed effects are often the result of different mechanisms and are not related to the substance's level of acute toxicity. Of pesticide poisoning symptoms is the key to preventing further injury. The label often provides important information on first aid procedures for the particular pesticide product. Make sure a copy of the label is readily available whenever you're using pesticides. Take the label to a medical professional
if a poisoning incident occurs.
Congratulations, you have completed Chapter 5 Part 2. Please proceed to the exam.